Another challenge that we do see with HER2 positive disease is with regards to HER2 heterogeneity. So we know that there are some HER2 positive cancers where there may be some cells, for example, that are either have low HER2 positivity or no HER2 positivity in a setting of a HER2 positive cancer. And so this can be challenging, particularly as we are moving towards treatment that may be solely HER2 directed. So I think where this becomes quite clear is in a trial that was conducted by Otto Metzger, where he had taken patients who were getting preoperative TDM1 and pertuzumab for 6 cycles and had looked at those patients' outcome by whether or not they had a heterogeneous HER2 positive tumor up front. So they defined heterogeneity as having a tumor that had a FISH ratio and that was positive only in 5 to 50% of this tumor, or having a focus that was HER2 negative. And so if you met these criteria, the tumor was considered HER2 heterogeneous. And this was the case in about 10% of patients that enrolled in the trial. And interestingly, the majority of patients with HER2 heterogeneity had hormone receptor positive, HER2 positive tumors. So about 80% of those heterogeneous tumors were hormone receptor positive. And then when they looked to see how those patients did after receiving TDM1 and pertuzumab, you could see that there were no patients who had a pathologic complete response if they had a heterogeneous tumor, which was very different than patients who did not have HER2 heterogeneity, where the PCR rate was 55%. So clearly having heterogeneity meant that there was less sensitivity to TDM1 and pertuzumab up front. And so something I think that certainly also comes to light with data that we saw from the Christine trial, where we saw similar challenges with heterogeneous tumors with preoperative TDM1 based treatment.